Now I will demonstrate how to auscultate for the aortic stenosis murmur. Aortic stenosis murmur is a low-pitched murmur. Generally it has two components, that is low-pitched component and the high-pitched component. Low-pitched component is conducted to the carotids and high-pitched component is conducted to the mitral area or the apex of the heart. Now first we will auscultate the murmur, the aortic stenosis murmur, which is ejection systolic murmur, that is it is a mid-systolic murmur. First we should auscultate at the base of the heart, that is in the right second intercostal space. So we ask the patient to slightly bend forwards and we have to auscultate during the expiration part. Usually the murmur is low pitched. We have to preferably auscultate with the bell of the stethoscope, and we hear the murmur as the rough and rasping in character. The low pitched murmur is heard at the right second intercostal space, best heard during the expiration, and the patient position should be slightly bent forwards. Then we proceed to hear the murmur at the apex of the heart. Because the aortic stenotic murmur, which is an ejection systolic murmur, is transmitted, that is conducted to the apex of the heart. Now we try to listen the murmur which is conducted to the apex. So we hear the murmur at the apex of the heart, which is the high pitched component. This phenomenon is Gallowerdin phenomenon, where the murmur of the aortic stenosis, that is ejection systolic murmur, which is heard at the base of the heart, right second intercostal space, is conducted to apex of the heart, which mimics that of the mitral regurgitation murmur. But the differentiating point is, in mitral regurgitation, the murmur which is heard at the apex of the heart is radiated to the axilla. Now we try to listen at the axilla if the murmur is present or not at the axilla. So here in the axilla there is S1 and S2. There is no murmur in between the S1 and S2. That is, in systole we cannot hear the murmur in this patient in the axilla. So the murmur is not radiated to the axilla. So we can differentiate the MR murmur, that is mitral regurgitation murmur, from the aortic stenotic murmur due to the absence of the murmur, radiation of the murmur to the axilla. So first we heard the murmur at the right second intercostal space with patient position leaning forwards and during the expiration. Then the high pitched component we heard at the apex, which is high pitched component, ejection systolic murmur conducted to the apex of the heart, and it is not radiated to the axilla, so we differentiated it from the mitral regurgitation murmur. Now we try to hear the murmur at the carotids. The low pitched component of the ejection systolic murmur is conducted to the carotids. The low pitched component of the ejection systolic murmur is conducted transmitted to the carotids, and we clearly hear the ejection systolic murmur conducting to the carotids. Here we have to remember there is Gallowerdin phenomenon, which is conduction of the murmur to the apex of the heart, which mimics that of the MR murmur.